I'm not exaggerating when I say that spotting these signs on your skin could actually save your life or someone you care about. Pattern recognition is key when you're identifying rashes, so I'm going to show you lots of examples so you can start to see the similarities and differences. So let's dive into it. These two rashes look pretty similar, right? But one primarily affects appearance, while the other is a sign of something far more serious that can affect every organ in the body. You're going to see that this is a bit of a theme in this video. Similar looking rashes with different underlying causes. So this patient has lupus, and what you're seeing is a classic malar rash. It spreads across the cheeks and nose, often forming a shape similar to a butterfly. And this rash is probably the most recognizable sign of lupus, a systemic autoimmune disease that impacts everything from the joints to the kidneys, lungs, and brain.
Finally have a case of lupus.
In comparison, this other patient has rosacea, which is a chronic skin condition that causes redness, visible blood vessels, and even bumps that look like acne. And people will notice that it gets worse with spicy foods, alcohol, or sunlight. But aside from the cosmetic issues, which can be really distressing for people, it fortunately doesn't seem to have any impact on your overall health. So clearly, it's important to tell these rashes apart. And here are some strategies that I use. Look closely at this area of the face, the nasolabial folds. Interestingly, lupus usually does not affect this area. So for simplicity's sake, if you have a rash like this, and the rash is present in the nasolabial folds, then it's likely not lupus. The second thing to consider is other symptoms that can flare up with this rash. Because although the rash will often bring people into my office, when I start digging and asking them questions, they're often having a lot of other symptoms that are related to all the inflammation caused by lupus. Check out the lupus classification criteria to get a sense of the wide range of signs and symptoms that we're looking for. So if you've got this rash, and especially if you've got other symptoms with it, you definitely need to see your doctor. Over the years, some of you guys have emailed me asking if I have a malar rash, and while I love that you're so observant and thinking about it, nope, I just have a lot of freckles. Next, I want to share with you a simple trick that doctors use to determine whether a rash could be caused by vasculitis, a group of conditions that cause inflammation in blood vessels and can cause irreversible damage to internal organs. Ideally, you would use a glass slide, but you can also just use a regular water glass at home. See how this rash disappears when you apply pressure? And then when you release the pressure, it returns? This is called a blanchable rash. Basically, this tells us that there are dilated blood vessels full of blood at the surface of the skin, giving it the red color. When you apply pressure, the blood is pushed out of the blood vessels and the red color disappears. This is actually a good thing because it tells us the blood is where it should be, inside the blood vessels. Now here's the concerning sign. If you apply pressure to the skin, but this time the rash does not disappear, that tells me that the blood has actually leaked out of the blood vessels. This can happen if you have very low platelets or a serious infection. This famously happens in meningococcemia. But I also see this all the time in autoimmune diseases, where the immune system attacks and destroys blood vessels. In fact, it was by spotting this type of rash that I made my first ever diagnosis of vasculitis as a second-year medical resident. I'll never forget it. I was on call overnight, and the emergency physician asked me to see a patient who had gone into kidney failure, but they didn't know why her kidneys had suddenly stopped working. I went through my usual history and physical exam, and when I got down to examining her legs, I noticed this small cluster of red dots on her foot that she hadn't noticed. And as you might have guessed, the rash was non-blanchable, so I was immediately thinking about vasculitis. I remember ordering the full vasculitis workup that night, and in the end, a few days later, she was diagnosed with granulomatosis with polyangiitis, a type of small vessel vasculitis. And this gave us the reason for her kidney failure. The same blood vessel destruction that was causing her rash was also happening inside her kidneys. By noticing the rash and diagnosing her as soon as possible, we were then able to suppress her immune system with medications and save her kidneys. And it was one of the moments that really solidified for me that I wanted to become a rheumatologist. Okay, now these rashes are pretty common, and I find people often confuse the two because they both cause red, itchy patches on the skin. But they're actually very different conditions, and one of them comes with an increased risk of heart disease. And to tell the difference, I like to focus on the location and the appearance of the rash. This is eczema, and it tends to affect the flexor surfaces of the body. Think about skin areas that bend, like the inner elbow, wrists, and behind the knees, although it can also show up on the neck, face, and hands. In comparison, this is psoriasis, and it usually affects the extensor surfaces. So think about skin areas that stretch, like the elbows and knees, although psoriasis can also show up on the scalp, palms, and soles of the feet. So as a very general rule, think about eczema on the inside of the elbow and psoriasis on the outside of the elbow. And when we compare the appearance, eczema tends to be more red and inflamed and intensely itchy. In fact, we often call it the itch that rashes because the itchiness usually shows up before the redness. In comparison, psoriasis tends to form thick silvery white scales on top of the red plaques. And the reason it's so important to differentiate the two is not only because the treatments are different, but because they're associated with different medical conditions. For example, people with eczema are more likely to have hay fever and asthma, while people with psoriasis are more likely to develop arthritis and heart disease. But why is that? Well, it all comes down to what part of the immune system is being activated in these conditions. Psoriasis causes a more widespread and aggressive inflammatory response, and that inflammation affects the lining of the blood vessels, which can ultimately lead to clogged arteries in the heart. So making the right diagnosis not only allows us to treat the rash and the inflammation, but it allows us to be more aggressive at treating risk factors for heart disease. Okay, let's pivot to something totally different. This is a 68-year-old woman who noticed a sudden increase in hair growth. Notice how it's a really fine, white, soft hair. This is called acquired hypertrichosis lanuginosa, and it's almost always linked to an internal cancer. That's why it's sometimes called malignant down. In this case, the woman was diagnosed with colorectal cancer. Now, you might think that such a dramatic presentation must mean that the cancer was really advanced. But fortunately, that wasn't the case. The cancer actually hadn't spread, and the surgeon was able to remove it all. Okay, now onto something relatively common that you've probably seen before. This is acanthosis nigricans, and you can see how the skin takes on a darker, thicker quality, almost a velvety texture. While it can be linked to genetics, it's more often a sign of diabetes or polycystic ovarian syndrome. But why does this happen? Well, it's all linked to insulin resistance, which is the underlying issue in type 2 diabetes. Basically, your cells stop responding to normal levels of insulin, so your pancreas responds by producing even more insulin. This excess insulin binds to skin cells called keratinocytes and stimulates their growth. And more skin cells lead to the color and texture changes on the skin that we see here. So when I see this, I'm immediately concerned about insulin resistance, and I'm gonna do blood work to check for diabetes. The good news is that with proper treatment, including diet, exercise, weight loss, the rash will actually fade and can sometimes go away altogether. All right, now we all recognize this one. Yep, it's acne. It's frustrating at any age. You gotta love high school. But if you're breaking out as an adult, and that's new, it could be a concerning shift in your hormones. Conditions like PCOS, polycystic ovarian syndrome, Cushing's syndrome, or even an androgen-secreting tumor can all cause acne. I recently interviewed a woman with Cushing's disease, a tumor in her brain that was producing too much cortisol. Unfortunately, there were some delays in her diagnosis, and she gained over 100 pounds, had severe cystic acne, abnormal hair growth, and she developed these purple stretch marks all before she was diagnosed and treated for high cortisol levels. She's an incredibly resilient woman with a great message, and she's doing well now. So if you want to hear her whole story, I'll leave a link in the description. Have you ever noticed a purplish web-like pattern on someone's skin, particularly on their legs? This is livido reticularis, or marble skin, and it's usually caused by constriction of blood vessels. It's pretty common to see it on babies. About half of babies will get this type of rash when they're cold. But it doesn't mean that there's anything wrong, you just need to warm them up. But in some cases, it can signal something serious about your blood vessels, like vasculitis or antiphospholipid syndrome, an autoimmune disease that increases your risk of blood clots. So this is a rash you don't want to ignore. Now, this is dermatomyositis, another autoimmune disease that I treat as a rheumatologist. So it's a condition that causes distinct rashes and muscle weakness. In medical training, it felt like we were always being quizzed on the various rashes that you can develop in dermatomyositis, and of course, they all have specific names. You've got the heliotrope rash around the eyes, the malar rash that we talked about in lupus, the V sign on the chest, Schall sign on the back and shoulders, and Gottron's papules on the knuckles, elbows, and knees, just to name a few. So knowing this, it can almost be a spot diagnosis when you see this rash and a patient tells you that they're having trouble lifting their arms up or they can't get up from a chair. But the diagnostic process doesn't stop there. There's an association with cancer, particularly in older adults. This is a 53-year-old man who showed up at the rheumatology clinic with a heliotrope rash on his face, a shawl sign on his back, and Gottron papules on his knuckles. He was diagnosed with dermatomyositis, and then his doctors went hunting for cancer and found something in his lungs. Here's another example. This is a 73-year-old woman who came in with a rash around her eyes and thickened patches of skin on her knuckles and feet. In her case, an early stomach cancer was found. In both cases, these patients came in because of their rash and not because of typical symptoms of lung cancer or stomach cancer. In fact, the cancers were so small that they normally wouldn't cause symptoms at that point. So it's another example of how a rash can help diagnose a cancer early before it spreads and is much more difficult to treat. Okay, I'm gonna bet that most of you have had hives in the past, also known as urticaria. Red, itchy welts that are usually triggered by allergies or stress. And normally, these spots should come and go throughout the day. So you might get one hive, it'll fade and resolve within a few hours, and then another one will pop up. But one hive shouldn't be there for more than 24 hours. If your hives turn into a bruise, or they last more than 24 hours, or they're really painful and burning rather than itchy, that could be a sign of something more serious, like vasculitis. Yep, vasculitis again. Inflammation of the small blood vessels in your skin can cause a non-blanchable rash, livedo reticularis, and these atypical hives. Another rare but serious condition is tripe palms, where the skin on the palms and soles of your feet become a thick, velvety texture, like boiled tripe. 90% of the time when you see this, it's caused by cancer. And unfortunately, this patient was ultimately diagnosed with stomach cancer. So the common theme here is that your skin is an important indicator of your overall health. And if you notice a change, it's a good idea to see your doctor to make sure it's nothing serious. But your skin isn't the only part of your body that can give you important information about your health. For thousands of years, health practitioners have been looking at the tongue to help diagnose diseases. So I'd recommend watching this video next to learn what your tongue says about your health. Stay curious, stay healthy, and I'll see you in the next video. This is a member-driven channel, so if you want to show your support for the channel and get more involved in the content that I'm producing, then click this link up here to learn about the perks you get when you go from being a subscriber to a VMD member. Hope to see you in the next members-only livestream.